How were so many doctors and postmenopausal women deceived by the WHI PremPro clinical trial results in 2002? This is a timeline of the following the premature termination of the Women's Health Initiative clinical trial. On May 31st, at the regularly semi-annual meeting, the Independent Data and Safety Monitoring Board recommended that the WHI PremPro clinical trial be prematurely terminated because of an increased risk of breast cancer. The WHI Premarin-only clinical trial was allowed to continue. Dr. Russo, who was the head of the WHI clinical trials, accepted the Data and Safety Monitoring Boards, but abandoned all normal research protocol after that. He failed to immediately notify the women who were taking the PremPro to stop their PremPro, and he failed to immediately notify the 40 heads of the WHI clinical research centers. These doctors were medically responsible for the welfare of the women. So when the study was stopped because of an increased risk of breast cancer, both the doctors and the women taking that PremPro should have been notified. On June the 28th, Dr. Russo met with the heads of the 40 research centers, and for the first time, he revealed that he had stopped the study on May the 31st. They were livid. Why had they not been contacted immediately? But then he went further and shared with them for the first time that he had taken 2 PhD researchers involved in the Women's Health Initiative, and the 3 of them behind the backs of the 40 heads of the WHI clinical trials, analyze the data, determine what graphs and what tables to include in the subsequent paper. They wrote the paper and they submitted it to the Journal of the American Medical Association without ever notifying the 40 heads of the research centers. And the reason that's so important, these 40 heads of the clinical research centers were medically responsible for the well-being of the women taking the Premarin and PremPro in their clinical trials. So when the study was stopped on May 31st of 2002, the women and the 40 heads of the research centers should have been immediately notified. In speaking to a few of the heads of the research centers involved in that meeting, they told me it was the darkest memory in their clinical research histories. They had not been notified for 28 days about the study, but they were even more angry with the fact that they had not been able to participate and review the data before it was published. They had given up their life in academic medicine for 5 to 10 years, devoting their life to this study, and they weren't allowed to determine the meaning of the results of the study. So that at this point, they did not trust Dr. Rousseau. The doctors demanded that Dr. Rousseau check with the Journal of the American Medical Association to see if the 40 heads of the research centers could at least get copies of that manuscript to see if there were any changes they felt that were needed to be made. Dr. Rousseau said that he'd check over the noon hour and get back to them. When he got back to them after the noon hour, he told them it was too late to make any changes, that the papers had already were published, and were stored to be sent out to the public in the near future. When he suggested that he be the only one on the stage at the press conference that was to be held to bring this to the media and the world, they absolutely refused to allow that to happen. Eventually, after much discussion, I am told that he had consented to allow a woman to be with him on stage. The woman apparently was paraplegic and needed a wheelchair, but on the day of the press conference, there was no wheelchair access to the stage. Dr. Russo was the only doctor on stage. On July 9th at 11 a.m., at the NIH-sponsored press conference, we learned that the WHI PremPro clinical trial had been prematurely terminated due to an increased invasive breast cancer risk and lack of overall benefit, with increases in heart attacks, strokes, pulmonary embolism in the study participants. Dr. Rousseau indicated that the adverse effects of estrogen plus progestin apply to all women, irrespective of age, ethnicity, or prior disease status. This was not true. He indicated that the women with the uterus who currently are taking estrogen plus progestin should have a serious talk with their doctor to see whether they should continue it. He also warned that hormone long-term use or use for disease prevention must be reevaluated given the multiple adverse effects noted in Women's Health Initiative. An uncontested week-long media blitz by Dr. Rousseau followed. On July the 17th of 2002, the incomplete data version of the WHI PremPro clinical trial was published in JAMA. On page 7 of the results, we learn that the invasive breast cancer observed with estrogen and progesterone group almost reached nominal statistical significance. The increased risk of invasive breast cancer was not even statistically significant. Why was normal clinical research protocol not followed after the premature termination of the WHI PremPro clinical trial? Why were all the other WHI head researchers not involved in analyzing the data and writing the paper? Why the haste to publish incomplete WHI PremPro data that was not statistically significant? Why the secrecy? Did someone have a hidden agenda? Years later, in the Wall Street Journal on March the 1st of 2006, Dr. Rousseau reported that with the WHI PremPro clinical trial, he had wanted to have, and I'm quoting, the maximum effect on doctors and women to stop the practice of prescribing hormones to protect women's hearts. That was not his job. Why? Did Dr. Rousseau have a hidden agenda? As the head of all heart research dollars at the NIH, how far would he be willing to go? Major errors in the WHI Premarin and PremPro clinical trials. In these clinical trials, they falsely assume that the 30 to 50% reduction in heart attack observed in 30 to plus observational studies when estrogen or estrogen plus progesterone were initiated at the usual time before or usually shortly after menopause. For the usual reason, to reverse menopausal symptoms, they felt that they would also be observed in much older, asymptomatic, high-risk, unhealthy postmenopausal women after they had been estrogen deficient for many years. Remember I told you they were estrogen deficient for 12 years before starting the Premarin and PremPro in this diet. The problem is they were totally wrong on their assumption. Ways in which the Premarin PremPro clinical trial was sabotaged from showing that estrogen prevented heart attacks in postmenopausal women. Number one, inclusion of much older, asymptomatic, unhealthy women who were estrogen deficient for more than 5 years after menopause. Restricting the number of women who were less than 55 years to only 10% of the total participants. A special recruitment of older postmenopausal women 70 to 79 years. Inclusion criteria: postmenopausal women with previous atherosclerosis, heart attack, stroke, transient ischemic attacks, and high risk factors for heart disease, including obesity, high blood pressure, high cholesterol, diabetes, and cigarette smokers were included in a study whose primary outcome was the primary prevention of coronary heart disease. Two exclusion criteria basically eliminated postmenopausal women who were current hormone users or women who had moderate to severe menopausal symptoms from participating in the Premarin PremPro clinical trials. Volunteers were excluded if she was unable or unwilling to discontinue her current hormone therapy, or if she had moderate to severe menopausal symptoms during the 3-month washout that would have made the placebo treatment intolerable to these women. Investigating other medical conditions other than heart attack, such as hip fracture. If I was doing a study on heart attacks, I've told you I would want to start them on hormones before age 55. If I'm doing a study in hip fractures, I wouldn't see any hip fractures in that younger age group. I would want to study much older women, women in their 70s and 80s and higher. Secondly, allowing the volunteers to participate in more than one clinical research at a time. It is a dogma in medical research that a research participant can only participate in one study at a time. Third, the use of an anti-estrogen, the synthetic progesterone progesterone. 4. Using the same dose of hormone for all postmenopausal women 50 to 70 years of age. 5. Placing the researcher's agenda and biases over the integrity and the postmenopausal women.